Hey, how are we doing?
Good. How
Everybody
are
okay?
you?
My name is Blake. I'm one of the student pharmacists here, so I'm going to be telling you about some medicine. Are you Mr. Grayson? How old are you, Mr. Grayson?
3.
3 years old. Oh my goodness. Who do you have here with you? Is this your brother Brody?
Yes.
Brody, how old are you, buddy?
4.
4. And then this is Stacy, and you're the mom, correct?
Yes, I am.
Excellent. All right. So, your doctor wanted me to talk to you about some medicine we're getting for the boo-boo on your arm.
Where's your boo-boo?
Can you point to it? Yeah. So this has been causing some redness and swelling, maybe a little bit of drainage and stuff like that, correct?
Yep. Super itchy.
Oh yeah. So what we have prescribed for you today is amoxicillin, which is an antibiotic. So I'm gonna talk to you, Grayson, about how to take it. Does that sound good? Okay. And before we begin, just verify, does Grayson have any medical problems?
No medical problems.
Okay. Is he allergic to any medicine?
Not that we're aware of.
Take any prescribed medicine daily?
No.
All right.
Do you?
And,
No.
and anything over the counter?
Nope.
Okay. Good deal. All right, well, let's get started. So the antibiotic we are prescribing you today is called amoxicillin with clavulanate. It's a pretty common antibiotic. What we'll do is we'll take 400 milligrams or 5 milliliters twice a day. So it'll be every 12 hours.
Okay.
All right. And I see you have your syringe, so you've had some medicine before, right? So what we
Yes, sir.
have in here is some water, correct? And you drew this up yourself, didn't you?
Did you put the water in there? Yes,
So
ma'am.
could you show me how you would take that medicine if we have it in the syringe?
How do you take it?
Pushed it.
Yeah,
Do it.
so you,
Show 'em.
what color do you push?
No, like put it in your mouth and do it. Don't do it on the floor.
Good job, buddy. That's exactly what we're gonna do. So this amoxicillin or antibiotic, what it's gonna do is help build up this little boo-boo here. Okay? And you take it just like you did, and if you want, you can even draw it up if your mom is okay with it. Does that sound good?
Okay, we'll practice. Okay, so what do we do if he's allergic to it? Like, what are signs of being allergic to
Of
amoxicillin?
course, that's a great question. So you could have a rash to the area or any rash throughout the body. That could be a sign of an allergic reaction. Also, any difficulty breathing or wheezing that you notice could be a sign of allergic reaction.
Is that genetic?
It could be, or do you have a history of allergies to
His dad
amoxicillin?
is allergic to amoxicillin.
Okay. Well, this is something we'll watch closely for sure. So if we do experience any of those reactions or hives, itching, swelling in the throat, things like that, stop it immediately and we'll go to our doctor. Okay. All right. So you can store this medication just in any room temperature settings. Make sure it's not too hot or too cold. Some common side effects, like we've discussed, would be an allergic reaction if you would develop a response to that.
Does it affect sleeping?
It should not affect sleeping.
Major question.
If anything, can make him feel a little more tired.
Oh, perfect.
So, I imagine he's a big ball of energy all the time.
So you like sleep.
And also, you could experience some diarrhea, maybe some upset stomach with this. So it's not too common with everybody, but if he were to experience that, we could have a probiotic that we could have on board. I know you asked about that earlier, so we can get you one of those today too.
Perfect.
Okay, so what I recommend is have it taken 3 times a day or so. So basically, what that does is just help promote the good bacteria within our GI tract and our stomach and things like that. This help reduce the risk for diarrhea and things like that too.
Perfect.
And then you also have some Neosporin, you said.
Yep.
And you asked if that would be a good idea. That would be a great idea.
Okay.
We can apply it to the site. Just not too much, just enough to coat it.
Okay.
And we can do that twice a day as well. So what we'll do is keep that site clean with soap and water and things like that.
Is he able to take a bath with it, or does he need to keep it like shower oriented?
We can bathe with it.
Okay.
Yeah, that'd be okay. As long as we just wash it with some mild soap, keep it clean.
Does
and dry.
amoxicillin help to keep it from spreading, if you will, to like his brothers?
Yes, it could help by reducing the infection on the site. And if it is really, really itchy, we'll try not to itch it and try not to spread it as well. So
Okay.
some things we could do to cover up that site, maybe a little bit of long sleeve shirts, if we could do that. I know it's hot outside, but anything that can kind of cover up the site where you can't itch it and scratch it a lot.
Perfect.
So,
Feel good about it?
do you have any questions for me, Mr. Grayson?
Do you have any questions for Ms. Blake? No? Can you say thank you? Do you have any questions?
No.
No.
All right. Well, we feel pretty good. Stacy, do you have any questions for me?
I think we're good.
All
As
right.
long as we don't break out in hives.
That's right. We'll watch that closely, and hopefully that's not the case. The duration of this is typically just a few days, so we'll take this over the prescribed regimen and make sure we adhere to the therapy. Make sure he's getting his medicine on time. Again, it is twice a day, so throughout the duration, of course, make sure he just finishes it off. That way we can take care of that infection. But if it doesn't improve after we finish the antibiotic, just come back and see us, and we'll see how he's doing.
Perfect.
All right.
Feel
Well,
good
that's
about
it,
it?
man. Well, thank
High
you so much. All right. Thanks, Brody. You did good too, man. And thank you, Mom.
Thanks.